No, you speak about the reality, and it's a good thing, that a fully integrated and collaborative member of the Department of Public Health. Do you see any possibility, based on that fact, do you see any possibility for there to, in the future, be more therapeutic atmosphere or places for people to be as they are transitioning into the community? Like maybe in the community there are these kind of like halfway spaces or detox spaces where people can go before they go to a residential facility from custody to this place. Yep. Do you foresee any ability for the city and county to have anything where we have people who are in custody right now who need a therapeutic psychiatric setting and are waiting to transition, just per se they need that, or they're waiting to transition to something in the community that is secure but therapeutic? I know that the city rejected funds for a jail a couple years ago, but is there any possibility for a setting like that to be created and not, well, I'll just put a period then.
A locked facility?
So secure, so that you can't walk out without, on your own. So there would have to be, I guess just like the psychiatric facility at General is locked.
Yeah, I mean, there's clearly a need for that level of care. And currently, that kind of care is mostly provided for people who are violent or are perceived as violent in the jail. And the jail is not a therapeutic environment, period, full stop. But we do provide, care, treatment, because that is the location where this person in need is. Is it, when I say it's not a therapeutic environment, it's a traumatic environment for many people. So I don't know that people can, especially those with serious mental illness who are violent, can really achieve the full possibility of healing in a location like that. And I think that's, I think we know, that's why we had state hospitals, and, that's a shift from a carceral setting to a therapeutic environment, but it's a very secure environment. And there's no question we need more of those beds in our state. And the state is decreasing those beds over time. So what to do with those people who need that level of care is a hard thing to grapple with. And I think many people do not want to, and I'll just end on this, are concerned about putting money toward treatment that's inside a secure or locked place. They want the treatment in the community so people don't end up in that locked place. And then there are these people who are in that locked place. So how do we make that transition to the day when we don't need those kinds of locked beds without abandoning those people who are there now? I think that's a tough one.
Thank you.
Yeah, thank you. Thanks for the questions.
Thank you. It was a great presentation, and I hope you feel better.
I will, and thank you for your attention.
Okay, thank you.
Thank you again, Dr. Pratt. We can move on to item 6, emerging issues.
No such thing.
Hearing none, then we can go on to public comment. This is for the Community and Public Health Committee meeting. I see nothing, no one online. And so we can go to item 8, a consideration for adjournment.
Motion to adjourn.
Second.
Oh, all in favor?
Aye.
All right, thank you so much.
You.